Hello everyone, I am Miss Sarbani Roy, roll number PH10, pursuing my post graduation in MPharm Pharmaceutics plus MBA in Pharmaceutical Technology and Healthcare Management from SVKM's NMIMS. I am excited to share that I am performing my first data analytics project right from inputting the data to Excel to final dashboard creation under my subject called Business and Health Analytics using Power BI. Today, I will be presenting my Power BI dashboard titled Hospital Patient Readmission Analytics. The goal of this project is to analyze the patient level data. Second is to understand the factors drive hospital readmissions. Third is to present the finding visually in a clear and meaningful way. Fourth is to provide insights that the hospital can use to improve patient care and operational efficiency. This dashboard is designed for hospital administrators, decision makers, and healthcare managers who want quick but deep insights into the patient outcomes. So, before we dive into the visuals, let me explain you the layout. On the left hand side, as here you can see, uh, I have the demographic slicer. At the top, I have the key performance indicators, and in the middle and bottom, I have the analytical visuals to explore readmission behavior from different angles. I have used blue and green theme to convey a clean and health oriented look. The choice of the color is intentional. Green is used for the patient related matrices because it symbolizes health, growth, stability, and patient volume. Blue is used for the risk indicators like readmission rate because it signifies caution, analytics, focus, and serious outcomes. The darker shade represent the higher risk or higher values, and lighter shade represent the low, lower intensity. This pattern allows the decision makers to immediately understand the risk areas and patterns without confusion. Now, uh, talking about slicers. On the left, I have three important slicers. First one is race, second is the gender, and the third is the age band. In race, I have African American, Caucasian, and unknown. In gender, I have female and male. In age bands, I have aged peoples. I have mentioned the aged peoples from 40 to 50, 50 to 60, and 60 to 70, and 70 to 80. These slices allow us to drill down into specific population segments. For example, if I want to analyze only the elderly female patients, I can simply select the combination and enter in the dashboard, and it dynamically updates. Now, talking about the KPIs, that is key performance indicators. Total patients, that is 25,000. Our dataset consists of 25,000 patients, which is a good sample size for hospital analysis. The readmission rate, that is coming to the next KPI, that is readmission rate. It is 0.46. This means 46% of the patients were readmitted within the defined period, and this is very high rate indicating a potential gap in the follow up care or treatment efficacies. Coming to the next KPI, that is Average length of stay. The patient stayed around 4 to 5 days on an average. This reflects the modern treatment period. Coming to the next KPI, that is average medication, that is 15.99. On an average, each patient has prescribed 16 medication, highlighting the critical complexities. Coming to the next KPI, that is average lab procedures, that is 42.96. The average number of lab procedure is 43, showing a high dependency on democratic testing. So all these KPIs are displayed in a bold and a black on white for maximum clarity. Next, talking about the charts. So the first chart, that is total patient by length of hospital stay and readmission. This chart uses the green shade for the patient counts and blue and green splits to represent the readmission. As you can see, this is for the green shade for the patient counts, that is 24,009 as here it's shown, and here the blue and the green, this both slit to represent the readmissions. Here, blue bar, it shows that readmitted is 1, and here readmitted in green bar it is showing 0. Most of the patients stayed the interpretation here is most patients stayed between 3 to 6 days. Both readmitted, that is blue, and non readmitted is in green. Patients appear across almost every length of stay. The pattern suggests the length of the stay. The pattern length of the stay alone and does not determine the readmission. The visual here helps the hospital management to understand the patient volume and care duration patterns. Next, coming to the next chart, that is patient and readmission rate by number of medications. So here you can see that this is one of the most important visual in the dashboard, that is green bars represent the number of patient and blue lines here represent the readmission rate. So the key insights that we know here is that as the number of medication increases, the readmission rate also increases. When the medication counts crosses 20 to 25, the readmission rate also sharply increases. Beyond 30 medication, almost all the patients are readmitted and indicated by the flat blue line near 1.0. Here you can see. This chart strongly suggests that high medication load is a major predictor of readmission. Now coming to the next chart, that is donut chart. The donut chart uses the green and the blue. Green for the readmitted patient, and blue is for green is for the non-readmitted patient and blue is for the readmitted patients. This helps the viewers to instantly distinguish between the outcomes. As you can see in green, the total number of candidate or the patients were 13,590, that is 54.36% were readmitted, and in and 11,410 patients were readmitted, um, and 45.64, that is 45.64%. This shows almost half of the patients return to the hospital, which is a major operational challenge. Now coming to the next graph, that is diagnosis count Distribution. This chart uses the shades of green. The interpretation here is the most of the patient have been between 8 to 10 diagnoses, and this means a large number of patients suffers from multi-chronic or complex conditions. The patients with high diagnosis counts ongoing monitoring explains higher readmission probability, and the visual here is to identify the clinical complexity in the patient population. Now, coming to the next chart, that is count of race by race. This chart uses the green bars to maintain simplicity and uniformity. As you can see, the Caucasian patient represent the largest portion of the dataset, and African American patients form the next major group, that this one, this graph, and the third is a smaller number of unknown race entities exist. Understanding the race distribution helps the healthcare providers to plan the community specific programs. Now I'll be switching to the next page. Now you can see here also there are different type of graphs are represented. The first one is this bar chart shows how readmission rate varies across different age group. These are the different age groups mentioned. The each bar represent the age band, and the height of the bar indicates the percentage of the patients who were readmitted from the age groups. Meaning of the colors. The bars are in green, which is the theme color used in the dashboard for the patient related matrices. Using a single color measures, the audience focuses on different bar heights, which represent the actual insights. Now, the readmission rate in 80 to between 80 to 90. The tallest bar belongs to 80 to 90 age group, showing the highest readmission rate among all the groups. This is expected because the older patient have multiple chronic conditions and this immunity is weaker. They require a more frequent medical attentions and they are more likely to return to the hospital within a short period. Now coming to the next graph, that is between 70 to 80 and 60 to 70. The age groups are also high. After 80 to 90, the next highest readmission rates appears in the age band is 70 to 80 and 60 to 70. This indicates that the higher readmission gradually increases with the age, especially from 60 years onwards. This side. The key insight is the middle age group, that is 40 to 50 or 50 to 60 slowly and slightly lower the rates. That is here from 40 to 50 and 50 to 60 shows a slightly lower readmission rate compared to the older age groups. The possible reason include better immunity, fewer chronic disease, faster recovery and more active lifestyle compared to the early patients. Now, lowest readmission rate is unknown age group. The unknown category here in the last, which is there, is the category has the lowest readmission rate. This does not mean they are healthier. It simply indicates that the age was not recorded in the data set or the sample size was smaller. The clinical interpretation that we observe here is this chart clearly suggests that the age is the major factor influencing the hospital readmission. The patient grow older, the readmission risk increases steadily. Early elderly age group, that is 60 to 90, needs more follow up and supports such as post discharge calls, medication counseling, home nursing, telemedicine check ins. Hospital can use these insights to design the age specific care programs. Now, this visual helps the hospital decision makers to identify high risk age group, allocate medical resources more effectively, reduce readmission through age based interventions program, improve services quality for elderly patients. From this graph, we summarize that readmission rate is highest in the 80 to 90 age band, followed by 70 to 80, 60 to 70, middle age group, that is 40 to 50 and 50 to 60, show moderately lower rates. Age contributes significantly to readmission risk. This emphasizes the need of enhanced monitoring for elderly patients. Now, coming to the next graph, that is, here is a clear, the corrected presentation of the donut chart shown the gender wise distribution of the patient who were readmitted. It tells us how many males and females returned to the hospital after the first discharge. The green is the female population, and the blue or the dark blue is for indicating the male population. This contrast colors makes it easy to compare two groups. This chart displays the female, that is 13,437, uh, that is patients were readmitted, and 53.75% of the total readmission, and male, that is 11,563 male patients were readmitted, and 46.25% of the total readmission. This chart shows that the female make up 53.75% of the total readmission patients, while males make up to 46.25%. The difference is not extremely large, but it indicates the female population contributes more to readmission numbers. It is important to note that the chart shows count and not readmission rate. The reason females have more readmission may be because there are more female patients in the dataset. Females generally have longer life expectancy, increases their hospital visits. Female patients have more higher chronic disease prevalence in their data, and females may also follow medical advice and revisits the hospital more consistently. Certain gender specific conditions contribute to more visits. Now, male. Male readmission count is lower. Male contribute to 46.25% of the readmission cases. The possible reason include lower male patient population. Men often delay seeking the medical help, which affects the hospital utilization. Male may underreport the symptoms or avoid follow-up appointments. Now, this visual helps the hospital to understand the gender patterns in a readmission patterns in the readmission. It supports the gender-based follow-up strategies, chronic disease management programs, personalized health education, resource allocation based on demographics and demand. If the patient, if the female form a larger part of the readmission numbers, the hospital can introduce focused counseling, wellness program, and post discharge follow up targeted towards the female patients. Next, to summarize this chart, that is 13,437 female and 53.75% were readmitted, and here 11,563, that is 46.25% of the patient make up a slightly higher uh, proportion of the readmission. This chart helps us to identify the gender based patterns and supports a better healthcare planning. Now coming to the next chart, that is this chart analyzes how the number of previous inpatient visit influence the both. The total number of patient is shown by the green graph here as you can see, and the total number of patients shown by the green bars are the re and the readmission rate is shown by the dark blue line as here you can see. The green bars total number of patients with each number of inpatient visits, and blue line readmission rate, that is percentage of patients who were readmitted. Green is for the volume and blue is for the risk. This combination makes it easy to compare how many patients versus how risk how risky they are. The first bar uh, is extremely tall, showing that, as you can see here, the most of the patients are for the first time or fresh admissions and they have not been hospitalized earlier. This indicates that a large portion of the patient population comes from a one time treatment. As the number of inpatient increases from 1 to 20, the green bars drop drastically, as you can see here. Very few patients have high inpatient visit numbers, and this means repeated hospitalization is a rare but important. This is expected because only choice or severe patient tends to admitted repeatedly. Now the most important observation in this chart is the blue line. The readmission rate increases sharply as the inpatient count rises. The patients with zero visits have moderate readmission. By the time the patient has 3 to 5 prior inpatient visits, their readmission risk become very high. After 10 or more inpatient visits, the readmission rate reaches almost 100%. Now, the patients who were hospitalized previously and are extremely likely to come back again, this is a classic sign of chronic disease, long term conditions, complex medication profiles, early or high risk patients. The clinical interpretation that we can conclude from this graph is that, from this chart, is that it strongly suggests previous hospitalization is one of the strongest predictor of future hospitalization. These patients need regular follow ups, medication monitoring, home care or telemedicine, lifestyle support, more aggressive disease management. Now, to summarize this chart, most of the patients, that is, have zero prior inpatient visits shown by the taller green bar. As inpatient visit increases, the patient count drops. However, the readmission rate sharply rises and more inpatient visits. After about 10 to 15 visits, readmission becomes almost certain. This proves that the patient with multiple past hospitalization are the highest risk group and they need special monitoring and care plans. Now coming to the next graph, that is, this chart explores how the number of outpatient visits influences. The total number of patients are in green bars, as here you can see, and the readmission rate is in blue line. Here you can observe. The green bars are the total number of patients in each outcome visit category, and blue line are the readmission rate of each category. The green shows patient volume and blue highlights the risk trends. The green bar at zero outpatient visit is extremely tall. This means most patients did not attend any outpatient follow-up appointments. They only visited the hospital when they require the inpatient care or emergency treatment. Now, total patient counts drop rapidly after 1 to 3 visits. As the number of outpatient visits increases, the number bar drop very sharply. As you can see that the patient count becomes very low at 3 to 5 visits. Outpatient visits become 10 are extremely rare. This shows that only small percentage of the patients constantly use the outpatient services. The blue line showed an interesting and unexpected pattern. An outpatient visit increases, the readmission rate becomes very high. Beyond 10 outpatient visits, the readmission rate repeatedly spikes. Beyond 20 to 25 outpatient visits, the readmission rate reaches almost 100%. This indicates the patient who make very frequent outpatient visits usually have chronic illness, never regular checkups, have complex medical profiles, and more likely to be admitted again, belong to the highest risk population. Thus, outpatients visit count is directly a marker to serve the disease. You may see the sudden dips in the blue line. This is because one or two patients exist in three categories. Even a single readmission drastically changes in percentage, and small sample size creates a sharp spike, drops drops, as here you can see. Then this is normal and expected in medical data sets. Now the clinical interpretation here is, this chart tells us regular outpatient visit do not cause higher readmission. Instead, they reflect the severe or chronic health condition. Frequent outpatient visits are a warning sign that the patient is at a high risk case. These patients used better diagnosis management, medication counseling, continuous monitoring, and potential home care or telehealth follow-ups. To summarize this chart, most of the patients have zero output visit shown by the tall green bar, and very few patients use outpatient service regularly. The patients with many outpatient visits have very high readmission rates. This is because they are typically chronic, complex, or high risk individuals. Outpatient visit count can therefore be used as an early warning indicator for the risk for the readmission risk. Now coming to the next chart, that is, this chart explores the relationship between the number of lab procedures a patient undergoes, the total number of patient who falls in this category, that is green bar, and the readmission rate for each category is in blue line. This helps us to indicate if the lab procedures are associated with a higher chance of being readmitted to the hospital. Green bars, the total number of patients who had that many lab procedures, and blue line readmission rate for the number of lab procedures, and background light purple for the visual contrast. The bars, the green bars form a bell curve, as here you can observe it is in bell shaped. The most of the patient had around 30 to 60 lab tests. The highest concentration of the patient in concentrated at 45 procedures. Very few patient had fewer than 20 or more than 80 lab tests. This means hospital usually performs 40 to 50 tests per patient as per their diagnostic workforce. Now, looking at the blue line, from 0 to 80 lab procedures, the readmission rate stays most mostly between 30% to 50%. This suggests that the moderate or the high number of tests is not strongly associated with the readmission. In fact, the lab testing seems the natural and slightly proactive, and it allows for better diagnostics and treatment. Uh, After 100 plus lab procedure, the readmission rate reaches to 1.0. Every single patient with that many lab tests were readmitted. These patients likely to had very serious conditions, multiple complications, or were in ICU like monitoring. This tells us the extremely high lab usage is a strong indicator for critical illness. Now you will notice that the spike in the dips and blue lines at the bottom ends, especially greater than 20 and less than 100, these are likely due to fewer patients in those ranges, which makes the percentage very widely. Even 1 to 2 readmission can make the rate 100 or 0%. So, always consider the sample size when interpreting the extreme values. The clinical interpretation here is that this chart suggests that a moderate number of lab tests is common and does not predict the readmission. Very high lab test counts over 90 to 100 are strongly associated with a high severity and risk. This patient needs closer and follow-ups after discharge. Lab counts can serve as a proxy for the disease complexity. It is important for the visuals that hospital and re-administrator can use these insights to flag high lab procedure patient as a high risk, ensure proper post-discharge care of the patient, review testing protocols to balance the cost and benefit, predict which patient may need readmission prevention programs. Uh, from this chart, we summarize that most patients had 40 to 60 lab procedures. Readmission rate was stable around 30 to 50% most ranges, and when lab procedure extended 100, the readmission rate hits 100, and this shows that the high lab procedure counts reflect the critical illness. Hospitals can use the lab count as a red flag for targeted follow ups. So, now again coming back to the first page. So, the business recommendation here is based on the insights of the dashboard. Based on the dashboard, my recommendations are prioritize high risk patient with high medication counts or high diagnostic counts should receive targeted follow-up calls and personalized care plans. Strengthen discharge planning. Provide clean medication instruction at discharge to prevent the complications. Third is to monitor the patient with frequent inpatient visits. Means these patients should be enrolled in a chronic disease management programs. Improve follow-up system. Use SMS reminders, telemedicine, or remote monitoring to reduce the readmission chances. Use this dashboard in a daily or weekly review meetings. It gives hospital managers a quick overview of the patient risk trends. Now, from this dashboard, we conclude that this Power BI dashboard provides a complete analytical view of patient readmission using clean visual design, clear color patterns, and interactive features. The dashboard helps to identify high risk patients, understand operational behavior, and make better health care decisions. This project demonstrates how analytics can significantly improve patient care and hospital management. Lastly, I would like to thank my professor, Mr. Harish Raul Gankar sir, for guiding us throughout the Power BI journey, starting from onboarding the Excel sheet to forecasting and creating the dashboard. He made us understand that how to work on the Power BI, not to get afraid of the Power BI. And with the help of his guidance, I was able to create this hospital readmission analysis dashboard. So, thank you, sir, so much. And thank you all for listening and watching my video. Please make sure to like and subscribe.